Assalamualaikum guys, our today's topic is about fracture of humerus. There are following types of fracture of humerus. The first one is a fracture of proximal end of humerus. The second one is a fracture of shaft of humerus. Third one is fracture of distal end of humerus. For sake to identify the ends, that which end is a distal end and which one is a proximal end, let we consider a central point on humerus. The end that is away from the central point will be a distal end, and the end that is before the central point will be a proximal end. Okay. Let me discuss about the number one, the fracture of proximal end of humerus. They are following fracture of surgical neck, now also known as the anatomical neck of humerus. Second one is a fracture of greater tubercle. There are also some other fractures like a fracture of you can say it greater tuberosity, lesser tuberosity, and lesser tubercle also too, but both of these are more important than others. So the most common fracture of proximal end of humerus is fracture of surgical neck of humerus, caused by osteoporosis and most common in oldies. Okay. The fracture of greater tubercle is a avulsion fracture. Avulsion fracture is a type of fracture in which a small part of bone is torn away. So it is usually referred as avulsion fracture. So in the case of fracture of greater tubercle, the subscapularis muscle and other muscles that are attached to the greater tubercle and the lesser tubercle pull the arm into medial rotation. They remain attached to their origin sites. Okay, origin insertion sites. The fracture of greater tubercle is usually caused due to excessive abduction and flexion of arm. So that one is a abduction, and if you move your hand towards mouth, then it will be a flexion movement. Okay. Next one is a fracture of distal end of humerus. The fracture of distal end of humerus. Okay. The fracture of distal end of humerus usually intercondylar fracture result from severe fall on flexed elbow. When your elbow is flexed and you fall on something, then intercondylar fracture occurs. In this type of fracture, the olecranon of ulna is driven like wedge between medial and lateral parts of condyle of humerus, may separate one or both parts. Okay, so next one is a fracture of shaft. Fracture of shaft is not much important, but there is a MCU point in a fracture of shaft. So there are two types of fracture of shaft. First one is a green stick fracture of shaft occur. Green stick fracture of shaft occur, and second one is a transverse fracture. Transverse fracture of shaft occurs. There are two types of fracture of shaft. So in transverse fracture of shaft, pull of deltoid muscle carries proximal fragment into lateral aspect into lateral side. So in transverse fracture of shaft, the deltoid muscle carries proximal you can say it fragment. The deltoid muscle carries proximal fragment into lateral rotation, and pull of biceps brachii can cause the foreshortening of fractured ends. Cause foreshortening of fracture ends. So that was a fracture of shaft. There are two types of fracture: greenstick fracture, transverse fracture. In transverse fracture, the deltoid muscle carries the proximal fragment into the lateral rotation, and the biceps brachii causes foreshortening of limbs. So that was two important points in a fracture of shaft, may appear as MCQs in your exam. Okay, let me discuss about some important points that are usually a part of your MCQ exams, your MLE exams, and other types of exams. First one is, if the surgical neck of humerus is fractured, then there will be an injury on axillary nerve. If the axillary nerve is injured, then teres minor and deltoid muscles becomes atrophied and can't perform their function properly. Okay, now if the radial groove of humerus is fractured, then there will be injury to radial nerve that can cause Saturday night palsy or wrist drop. So if there is a fracture of radial groove, then the radial nerve will be injured, that results into Saturday night palsy or wrist drop. Okay, if the distal end of humerus is fractured, then there will be an injury on median nerve. Median nerve is referred as labor nerve. Median nerve is referred as labor nerve. Okay, so here is a MCQ point. Distal end of humerus, fracture of distal end of humerus can result in injury to the median nerve. Okay, so the last one is, if there is a fracture of medial epicondyle, then there will be injury of ulnar nerve. Ulnar nerve injury can result into cubital tunnel syndrome. It can also cause claw hand. The most important demonstration of injury to ulnar nerve. So that was our today's topic. So I hope you have enjoyed it and understood it clearly. Stay tuned with us for further videos. Assalamu alaikum. Allah Hafiz.